Hey, it's Dominique Well from Well Medical Arts, and yay, I get the opportunity to show you guys something really special. So come take a look up close. This is the eye orbit, and this is called the lateral orbit, and then here is the temple. So beautiful and beautiful bone structure. The areas that we're seeing a little bit of volume loss, we want to get that lateral orbit, the temple, and just a tiny bit to the smile line. This is the side that has more volume loss, so I'm going to start here first. I'm using Bellafill. When we use the Bellafill periocular around the eye or in this orbit, we do not use it full strength, we dilute it down. And I will use one skin test to one syringe of Bellafill, mix it up with the female lure lock first, get it nice, and then I still use very caution, small, you'll see me work. And then when we go into the temple, I use it full strength. When I use it over here, it's gonna be full strength. You'll see the different techniques. We've already gone in and done a little bit of lidocaine. I'm gonna have you turn to the side. And we've already tested to make sure that she is good and numb. And a little 1, 2, oh, tiny poke. And this area, as we all know, tends to be very vascular, so there's always a chance of a bruise, but yay, it is not bleeding. And of course, we like to use the cannula, and you may feel a little bit here and there. There we go. And so if it gives me a little resistance, sometimes I'll go in and just put a little bit to get it to open up. And then proceed, there we go, a little bit. And this is very small amounts. Hang in there, baby, you're doing great. There it is. So it let me in. Thank you for letting me in. And then small. A little bit further. There, let me in a little bit more. That's where I want to be. So small amounts. And then I go in and feel with the finger. And then I go in small amount. This area is just a little bit sticky. And when I say sticky, I mean difficult to get in where I want to go. So just using gentle pressure. Already corrected out better with just a small amount. So these areas, the rule is small amounts, keep it under corrected. There we go. And coming around the corner. Now, when I teach you guys, just because a cannula is straight does not mean you can't draw with a curve with a cannula. So I don't know if you saw how I did that. Going around the corner. There it is. See the tip of the cannula come up right there? And this, I'm gonna go in a circle. Looking good. Then I wanna feel. And perfect. I'm not feeling any of the filler, which is exactly what I want. And I want to get a little bit more, so I'm still seeing a little volume loss right there and a little bit right there. This one's a little easier to get. Let's get that. Get it. Get it. You know how it is. It's also personally rewarding when you get it. Okay. And this syringe that I've got mixed up, I want to save half of it for the other side. This side, that's looking so much better. This side had a little bit more volume loss, so I planned on using a little bit more on this side. Now I want to go in and get that. That can be a little bit of a tight spot. She is such a good model, thank you. There it is. There it is. That looks beautiful. Yay! Now, I'm gonna switch over, you stay there, to the full strength Bellafill. I like to keep working on the same side while I'm over here. And then I'm just going to change the direction of my portal to go up right over the same hole. I love doing all of the work from the same hole. Less poke marks, less chance of swelling, bruising. And then we're gonna go in and we're gonna get this little bit to the temple. And then same thing with the small amounts. And these are just linear. And this side didn't have a ton of volume loss, just a little. There we go, nice. And nice, see how it's going underneath that blood vessel? We say, oh, thank you, cannula. We love you so much. We can do all of this work and not cause any bruising. Coming along. Let's do a little over this way. Beautiful. Now, traditionally, when I work a temple, I actually usually make my portal a little further back, but I did it this way so I could only have one portal. Almost. You're doing great. Sometimes when you're doing this at first, you can see just a few of the little threads. They're very fine, and they're at about a half a syringe, so gonna be stopping and saving room for the other side, but this side did have a little bit more volume loss. Looking good, maybe a tiny bit more this way. There it is, beautiful. Now with the Bellafill, we always do what I joke and call the rub, rub, rub. So you want to make sure that it is really nice and smooth so that when the Bellafill goes in and builds collagen, it does it nice and smooth and easy. And so you give it the vigorous rub, and I always tell the patient, yes, this vigorous is normal. The first time they did it to me, I was like, really? That much rubbing? Okay. And then after I do the rubbing, I go in and feel. And you're trying to make sure that you actually don't feel any filler. And you guys know, most of what you feel at first is kind of a little bit of swelling. Looks good. And any just small irregularities go down. That's just from kind of doing the work, but that looks amazing. Let's turn and see. Just a little bit of swelling, and actually I'm going to get a little bit of arnica. I'm going to come around this way. And there we go. So when I'm looking at it from the side, looks really nice and smooth and feels really nice and smooth. So that reassures me that any of those little irregularities that we're seeing, it's just from doing the work. Turn towards me. That's good. It's really good. Take a peek at this side.
Oh,
So,
wow, yeah, that's amazing.
Yeah.
That's amazing.
So a little bit of swelling right here.
Yeah.
Yeah.
Wow.
Isn't that nice?
That's beautiful.
Yep.
Yes.
And if it does end up there, we need a tiny bit more right there, we can put it, but I don't think we will.
Okay,
I
yeah.
think that's just kind of right next to the port and...
Wow, that looks amazing, yes.
Mm-hmm. Still very subtle, still undercorrected.
Yes,
Okay.
very natural.
And let's head on over to the other side. All right, here we go, working the other side. So we've put a little bit of 2% lighter there, and she's not feeling me poke her. And so breath in and exhale, tiny poke. And I actually like to make my portal in the direction that I'm going to go. Some people will just go straight down. I like to do almost what we call a little bit of pre-tunneling. You're already starting it out to make it a little bit easier. There we go. And I like to back traction on the skin to let it go in a little easier. A little bit more. So we're seeing all of this volume loss right through here. That is exactly what I'm shooting for. And this side is not as sticky. It's just letting me in, and my cannula, the tip of my cannula is right there. So I'm just gonna push the tissue a little forward. There we go. Now it's to where you see the end of my white. And I'm gonna start filling it up. Awesome. Another pass. Small amounts. Small amounts. Already looking better. And this is the same. This is the Dilute Bellafill. A little bit right through here. A little bit right through here. Look at that. It's already correcting out beautifully. This side's like, yeah, I want it. Thank you. And I'm going to go for a little, I'm still seeing a little bit of volume loss through here. And feel, I'm not feeling filler, which is great. And just for the record, we are trying to be as deep as possible on the bone. That is looking good and feeling good. Wow. Super great. This side is correcting out like a super happy camper. Now I know where my cannula is in space at all times because I've been doing it so long, it's like an extension of my finger. But if you are not sure of where your cannula is at all times, use your fingertip to feel and then trace it. Okay, and always listen to your sixth sense. It always knows, and mine is telling me we are good, even though we have a little filler left. I'm saying maybe a smidge right there. Undercorrecting is always better than overcorrecting. You can always go back and put more in. Let's check from the front. That's looking good from this angle. Let's check here. Great. Super great. I do just want a tiny bit of arnica. That little bit that we did in the front. Nice, nice, nice. And I'm still seeing just the tiniest amount right there. So we do love getting nitpicky. Us injectors tend to be very nitpicky. So there and there. Let me see, that's what I'm seeing. It's tiny, but let's get it. Right there is what I'm shooting for. I don't know if you guys can see that. And just a tiny bit more progression. Let me in. There it is. And see that cannula tip as I bump it up is right where we want it. And let's see if we can watch it fill. Yep, look at that, huh? Cool, cool, cool. Just about. Tiny bit right next to it. All right, from this angle, looking good. And then I wanted to get the other one right above. Just a little bit more. Right there. Right there. Beautiful. Look at that. And these are very, very small amounts. And then feel it. Small amounts that you can barely feel with the finger. There we go. That looks super smooth now. From this angle, let's check it from the front. Turn. Almost. And this, you guys, this is where that sixth sense comes in. When you're trying too hard to get it perfect is when sometimes too much will happen. This is when I like to stop and say, good. You gotta listen to that sixth sense. Okay, now I'm gonna turn around and get the temple. So I'm gonna make my portal come up. And 0 to 10, 0 is none and 10 is the worst in your life. How much is this hurting?
Oh, this is a 0 to 1 pain-wise. It's
Great.
Very easy.
Great. And although, you know, watching the video, it looks kind of stressful. And you're saying nice and calm. People do have a little bit of weird eye things. You know what I mean? A lot of people are like, by the eye. It's one of those things where the idea of doing it is actually much worse than doing it. And then when it comes to the temple, when I've had my temple done before, I just thought it was tight. Didn't really hurt, but it felt a little tight. Nice. 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 I do like going back into the hairline. In fact, on some people, come in, there we go. I do just hairline. See, it's all the way up here. And so you're getting more lift, hiding the filler in the hairline. Okay, a little bit more right over here. Got the lateral aspect. Let's get the medial. And this will give people a little bit of eyebrow lift. And we'll take a little of the shadow. See that shadow just lessened. There we go. Look at that. Very nice. We're almost done. You're doing super good. I'm feeling it. Good, good, good. Good, good, good. Just about there, a little bit more right there, right there, right there. Come on, baby, there she is. So good. And then our rub, rub, rub. Make sure it's all nice and smooth. Isn't that fantastic, you guys? So I just really wanted to show you a technique that I've found that works well. Wanted to share that with you. Yay! Let's look at it from the front. Turn. Bueno. Take a peek.
Oh, wow. That's amazing. That's so worth it.
Isn't that great?
Yes.
Yay!
Yay.
Okay, and good news, go ahead and lean back. We have just a tiny bit left to do these guys. Okay, finishing touches. We've got the temple, we've got the lateral orbit. This is just a teeny tiny little bit of a smile line. Breath in and exhale. I actually don't have that much filler left, but that's okay. We don't want a lot here. We all know we don't like to fill too much in the lower face. Just that little bit. And then I'm going to do the same thing other side. I have just a smidge.
That's good.
And breath in and exhale. Now, honestly, you'll probably need a little bit more in these next time. But I don't want to crack open a whole syringe for it, right?
Yeah.
And now gently open. I'm going to put my finger in and the thumb out to make sure that that is nice and smooth. And other side, gently open and feel good. Now, I want you to feel that with your tongue now, okay? Feel smooth. You don't feel anything, right? In a few minutes, you might, that's the swelling.
Okay.
And so for your home, what you're going to do is the warm compress. This works fantastic for the swelling. So you can put the wet washcloth in the microwave for like 25-30 seconds.
Okay.
Does this feel too hot or do you like it?
It's good.
I like hot too. Tell me if it's too much once it gets on.
Perfect.
Yay. And feel that amount of pressure that I'm putting? You can put that pressure to the temples.
Okay.
We don't have very much filler in the temples, so I don't expect you to have a headache, but sometimes people get a little headache when doing the temples. Use the warm compress, and that will help take down the pressure. And now look up towards the ceiling. This is the area that can swell, and this is the area that can retain swelling because it's an orbit, it's a socket. By nature, it's going to stay trapped in that little socket. Sometimes will, sometimes won't. Continue with your arnica, believe it or not, this warm compress, and then that lymphatic drainage where you're going over towards the temples, down in front of the ear, and down the anterior chain of the lymph nodes. Just keep going over and down. You're physically helping move the swelling out. And a lot of times if you wake up in the morning after being horizontal all night and it's had a chance to swell and to pool, swelling here never looks pretty. Don't panic. Do your warm compress, do your lymphatic drainage, take your arnica and keep up on it. And just give it a chance to heal. The body will heal. And if it's ever super bad, like, oh my God, my eyes are practically closed, please call us for some prednisone. All right, that's it.
All right.
Woo!